Drug addiction or substance use disorder is a disease that affects a person's brain and behavior and leads to the inability to control the use of legal or illegal medications. HuffPost lists 14 triggers that can start somebody on their road to addiction. These include the family being involved in drugs and alcohol, the neighborhood being drug infested, the addictive gene being passed on, the desire to belong, to be accepted, to be popular, feeling lonely, depressed, anything to take the pain. Experimentation that turns into addiction, trauma, boredom, and low self-esteem. When scientists look for the addictive genes, what they're really looking for is a biological difference that may make a person more vulnerable or less vulnerable to addiction. Every person responds to drugs and medications differently. The genetic connections to addictions come through the inherent levels of dopamine, a neurotransmitter made in the brain. High levels of dopamine can fuel poor impulse controls and tilt somebody towards addiction. Dopamine is a neurotransmitter that is involved in the brain's reward system and can influence addictive behaviors. It is not possible to get addicted to dopamine itself, but to activities or substances that increase dopamine levels. Drugs can activate a surge of dopamines that overwhelm the brain and lead to lower dopamine production and fewer receptors. While dopamine does play a role in addiction, this role is complex and not fully understood. Many believe it trains your brain to avoid unpleasant experiences and seek out pleasurable ones. Genetic testing for addiction identities certain genes and their variants that may predict who's at greater risk of developing substance use disorder. DNA sequencing technology have unveiled a number of addictive genes, so termed because of their relation to a person's vulnerability or lack thereof to substance abuse. However, genetic testing is still very imprecise science. Most diseases include addiction are complex and different genes contribute